You don't have to be a pro athlete to feel the pain of a stressed shoulder or elbow. This morning, our Living with Pain series continues with advice from experts on when it's time to see a doctor and the options now available to get relief. Here's ABC 3340's Cynthia Gould.
You have a little bit of impingement. It's mild.
It's a new era for diagnosing and treating shoulder and elbow pain. Ultrasound gives orthopedic doctors a detailed view.
Tiny little structures. I can see tiny little nerves and ligaments and tendons. I can see all of them. And the benefit of ultrasound is that I can see everything with the ultrasound imaging before I do any interventions.
That means no need to cut and insert an arthroscopic camera to find the problem. Dr. Ricardo Kohlberg with Andrews Sports Medicine calls this a game changer. When to see a doctor? Dr. Kohlberg says small injuries with soreness can be treated with over-the-counter anti-inflammatories. If not better in 3 days, get evaluated. Any trauma like a fall needs a visit to the doctor.
Especially with regards to the shoulder, there's risk of injuring the rotator cuff tendons and the labrum, and so those need to be evaluated by a specialist.
Treatment often starts with anti-inflammatory meds, physical therapy, and things like cortisone injections.
Surgery is going to be the last resort. In fact, 4 out of every 5 patients that we see don't need surgery.
Nutrition, exercise, good sleep, all so important to your recovery.
Exercising is actually extremely helpful for the healing process. When you exercise, you increase your heart rate, and that increases blood flow to the injured tissue, which brings nutrients and growth factors that stimulate that tissue to heal.
And sleep can help heal inflammation. The most common cause of shoulder and elbow injuries is the repetitive use straining your tendons, and something you may not have considered.
Sleeping on your side, especially with men. Men tend to have broad shoulders, wider shoulders and hips, and if you sleep directly on your side, that becomes a pressure point.
Decades later, those tendons can become irritated. Dr. Kohlberg says remember, early intervention often gives you the best chance for a good outcome. Cynthia Gould, ABC 3340 News.
Dr. Kohlberg says opioids for pain are used sparingly. For acute injuries, ice, rest, bracing, and PT have shown better results. Coming up in our next hour, jaw pain, the signs and treatment for TMJ.